Multiple choice questions, MCQs, on the topic of assessment of students with deaf-blindness, including assessment in different domains: vision, hearing, communication, motor, social, orientation and mobility, academic, behavior. Basic anatomy of eye and ear, structure and function. Challenges in assessment. Strategies before, during and after assessment. Children with deaf-blindness and additional disabilities. 1. Deaf-blindness is a combination of A. Visual impairment and ADHD. B. Hearing loss and mobility disorder. C. Significant hearing and vision impairments. D. Speech delay and anxiety. Answer: C. 2. The main goal of assessment in children with deaf-blindness is to A. Diagnose only academic level. B. Provide immediate therapy. C. Identify support needs across multiple domains. D. Label the disability. Answer: C. 3. An assessment of a child with deaf-blindness should be A. Done quickly in one session. B. Conducted in noisy environments. C. Multidisciplinary and individualized. D. Based only on academic testing. Answer: C. 4. One key challenge in assessing children with deaf-blindness is A. Too many books. B. Lack of sleep. C. Limited modes of communication. D. Overuse of technology. Answer: C. 5. The part of the eye that controls the amount of light entering is A. Retina. B. Iris. C. Lens. D. Cornea. Answer: B. 6. The retina functions to A. Pump blood. B. Transmit sound. C. Convert light into electrical signals. D. Protect the skull. Answer: C. 7. A structural assessment of the eye includes examining A. Hearing ability. B. Heart rate. C. Eye muscles, retina, optic nerve. D. Finger movement. Answer: C. 8. A functional vision assessment focuses on A. Anatomy only. B. How a child uses vision in daily life. C. Brain activity. D. Height measurement. Answer: B. 9. A tool commonly used in functional vision assessment is A. MRI. B. Logmar chart. C. Thermometer. D. ECG. Answer: B. 10. The cochlea is responsible for A. Balance only. B. Light processing. C. Converting sound waves into neural signals. D. Muscle movement. Answer: C. 11. The outer ear functions to A. Create sound. B. Catch and direct sound waves. C. Produce speech. D. Create balance. Answer: B. 12. Audiometry is used to assess A. Vision. B. Smell. C. Hearing thresholds. D. Blood pressure. Answer: C. 13. A structural assessment of the ear involves A. Eye chart reading. B. Tympanic membrane and inner ear structures. C. Hair testing. D. Finger tapping. Answer: B. 14. Communication assessment in deaf-blindness involves evaluating A. Hearing only. B. Reading fluency. C. Methods like tactile signs, gestures, and symbols. D. IQ levels. Answer: C. 15. One key focus in personal skills assessment is A. IQ score. B. Independence in dressing, toileting, and eating. C. Memory games. D. Playing sports. Answer: B. 16. A child using touch cues to communicate may require assessment in A. Mobility. B. Social cognition. C. Tactile communication methods. D. Academic spelling. Answer: 17. Assessment of communication for a deaf-blind child should involve A. Verbal interviews only. B. Use of AAC and tactile strategies. C. Rapid questioning. D. Reading tests. Answer: B. 18. Motor assessments help determine A. Cognitive potential. B. IQ only. C. Fine and gross motor coordination. D. Taste preferences. Answer C. 19. Orientation and mobility assessment includes A. Identifying safe travel skills and spatial awareness. B. Monitoring food intake. C. Judging eyesight. D. Musical abilities. Answer A. 20. Which professional is involved in mobility assessment? A. Orthoptist. B. Orientation and mobility specialist. C. Dermatologist. D. Ophthalmologist. Answer B. 21. A cane or tactile map may be used in diecast. A. Academic test. B. Orientation and mobility training. C. Speech therapy. D. Behavior observation. Answer B. 22. Academic assessment in deaf blindness should be A. Standardized only. B. Ignored. C. Modified using tactile, auditory or visual supports. D. Focused on peer comparison. Answer C. 23. A child with deaf blindness shows aggressive behavior. What is the first step? A. Punishment. B. Behavior functional assessment. C. Expulsion from Class D, IQ testing. Answer B. 24. Behavior assessment tools may include A. Anecdotal notes, ABC chart, frequency data. B. Blood test. C. Eye scanning. D. Vision chart. Answer A. 25. Academic assessments should emphasize A. Only writing speed. B. Age level expectations. C. Accessible formats and multi-sensory input. D. Peer pressure. Answer C. 26. Children with deaf blindness and additional disabilities may A. Be excluded from school. B. Require interdisciplinary assessments. C. Not benefit from any intervention. D. Need no support. Answer B. 27. One major challenge in assessing students with deaf blindness is A. Overcommunication. B. Difficulty in using standard tools. C. Too much reading. D. Speed of writing. Answer B. 28. Before assessing, the most important step is to A. Choose a punishment strategy. B. Understand child's preferred mode of communication. C. Begin with standard IQ tests. D. Use online surveys. Answer B. 29. Lack of trained professionals affects assessment by A. Improving quality. B. Ensuring accuracy. C. Reducing reliability and validity. D. Speeding up the process. Answer C. 30. Interpreters and interveners are needed during assessment for A. Decor. B. Communication access and clarity. C. Discipline. D. Technology repair. Answer B. 31. Before assessment, it is important to A. Avoid the child. B. Gather case history, communication preferences and contextual information. C. Test spelling. D. Plan field trips. Answer B. 32. During assessment, professionals should A. Use fast-paced instruction. B. Stay rigid to tools. C. Be flexible and observe cues and responses. D. Avoid giving breaks. Answer C. 33. After assessment, it is important to A. Close the file. B. Plan intervention strategies based on findings. C. Ignore reports. D. Remove records. Answer 34. One post-assessment practice is A. Dismissing results. B. Team discussion and follow-up planning. C. Retesting immediately. D. Comparing with peers. Answer B. 35. Documentation after assessment should be A. Informal. B. Standardized, individualized and family-friendly. C. Full of jargon. D. Avoided. Answer B. 36. Which strategy supports more accurate assessment in deaf-blind children? A. Rigid standardized test use. B. Contextual observation in natural settings. C. Testing alone in dark rooms. D. No interaction. Answer B. 37. If a child becomes fatigued during assessment, the assessor should A. Continue forcefully. B. End the session forever. C. Take a break and reschedule. D. Ignore the behavior. Answer. C. 38. Team-based assessments for deaf-blind children improve. A. Confusion. B. Fragmentation. C. Holistic understanding and intervention planning. D. Peer pressure. Answer. C. 39. One ethical principle in assessment is A. Rushing the process.